The data science and advanced analytics team really focuses on the fundamental problem of how we use data in healthcare. They say the average complex medical decision considers hundreds of parameters. So things like social history, family history, vital signs, symptoms, laboratory values, medical imaging results, all that stuff goes in our heads and we make a diagnosis. And sometimes, we're not very good at it. Can we use machines? Can we use AI to help us process all of that information rapidly and efficiently to help us make better decisions, which will translate into better outcomes for patients and a more efficient healthcare system? When clinicians come to us, they usually are struggling with problems day in and day out. They really understand what the issues are. They understand their workflows, what matters, what doesn't matter. They're the ones we really focus on. They define the problems that we work on, but we also engage them fully into the process.